The average cost of full-time childcare in America is $15,000 to $20,000 per year per child. That's more than in-state tuition at most public universities. In expensive cities, it's $25,000 to $35,000 or more. For a family with two young children, that's $40,000 to $60,000 annually just for childcare. And as we've discussed in previous videos, most families need two incomes to afford housing. But childcare costs can consume the entire second income, creating an impossible situation where you can't afford to work, but also can't afford not to work. Today, I'm going to walk you through what childcare used to cost, why it exploded, and why this is why people are having fewer children than they want. In 1990, typical full-time daycare cost $50 to $75 per week, or about $200 to $300 per month. Annually, that was $2,400 to $3,600 per child. Median household income in 1990 was $30,000, so childcare for one child was 8 to 12% of household income. For two children, 16 to 24%. Manageable, though not easy. Importantly, many families could afford to have one parent stay home because housing, healthcare, and other costs were low enough that a single earner could support a family, as we've covered in previous videos. Adjusted for inflation, that 1990 cost should be about $5,000 to $7,000 today. But actual child care costs are $15,000 to $20,000 or more, roughly 3 times what inflation predicts. Now, 2025. Full-time childcare typically costs $12,000 to $15,000 per year nationally. In expensive metros like New York, San Francisco, Boston, Seattle, costs are $20,000 to $35,000 per year per child. Infant care is higher because it requires lower child-to-caregiver ratios, $18,000 to $25,000 annually in moderate-cost areas, $30,000 to $40,000 in expensive cities. Monthly, $15,000 per year equals $1,250 per month. $25,000 equals $2,080 per month. For two young children, $30,000 to $50,000 per year are common. That's $2,500 to $4,200 per month. Let's work through the actual math families face. Scenario: family considering second income. One parent earns $60,000 as a teacher, the other could earn $45,000 as a nurse, two children under 5. That $45,000 second income sounds substantial, but taxes take 25 to 30%, leaving about $32,000 take-home. Childcare for two kids, $35,000 per year in many areas. $32,000 take-home minus $35,000 childcare equals negative $3,000. The second parent works at a net loss. Even with cheaper childcare at $30,000, the family nets only $2,000 annually. That's $167 per month for one parent working full-time. The trap. As we've documented in previous videos, housing costs require most families to have two incomes. You can't afford mortgage, property taxes, insurance, and utilities on one median income in most markets. But childcare for kids can consume the second income after taxes. So, need two incomes to afford housing, but childcare eats the second income. Can't afford both parents working, but can't afford one staying home because need two incomes for housing. Families are trapped. This is a major reason birth rates have fallen. Factor 1. Labor-intensive, can't be automated. Childcare requires qualified adults supervising small numbers of children. Regulations require ratios like 1 adult for 3 to 4 infants, 1 adult for 8 to 10 preschoolers. You can't automate childcare. You need the same number of workers per child today as in 1990. When labor costs increase, childcare costs increase proportionally. Childcare workers earn $12 to $15 an hour on average. Even modest wage increases flow directly to parent costs. Factor 2. Regulatory requirements increased. Regulations became stringent for good safety reasons, but they add costs. Facilities must meet specific standards: square footage per child, outdoor space, safety equipment, fire systems, secure entrances. Staff need background checks and training. Record keeping requires administrators. These improve quality but increase costs. Factor 3. Real estate and facility costs. Child care centers need significant space. Commercial real estate costs increased substantially. In expensive cities, facility rent can be tens of thousands monthly. If a center pays $20,000 per month for space and serves 80 children, that's $250 per child just for the building. Factor 4. Insurance and liability. Providers need substantial liability insurance. Risk of child injury creates exposure. Insurance costs increased with liability standards and lawsuit settlements. Centers also need property insurance, workers' comp, sometimes vehicle insurance. These add up. Factor 5. Limited competition. Starting childcare requires significant capital for facility, equipment, licenses, insurance, and regulations to meet. High barriers limit competition. Demand often exceeds supply. When demand exceeds supply, providers charge higher prices. Waiting lists are common. Factor 6. The Baumol effect. Economic concept. Services that can't be automated increase in price faster than goods that can be produced more efficiently. Childcare is classic example. A worker in 2025 doesn't supervise more children than in 1990. No efficiency gain. But wages must increase to compete for workers. Without productivity increase, wage increases show up as higher parent prices. The U.S. is unusual among developed countries in how expensive childcare is. Government subsidies elsewhere. Most developed countries heavily subsidize childcare. France, largely publicly funded. Parents pay a few €100 monthly. Germany, increasingly free or very low cost. Nordic countries, universal public childcare, modest income-based fees. Canada recently implemented $10 per day childcare in several provinces. The U.S. provides minimal support. Some low-income families get subsidies through limited programs, but most families pay full market rate. Why governments subsidize? Enables parents to work, increasing tax revenue and productivity. If a nurse stays home because childcare costs equal her earnings, that's a trained professional not contributing. High-quality early education benefits child development long-term. Supports birth rates as populations age. The U.S. chose not to make these investments federally, leaving childcare as a private expense. Suppressing birth rates. As we discussed in the birth rate video, childcare is the single largest ongoing expense of raising young children. Its high cost directly impacts family planning. Surveys show young adults cite childcare costs as reason for delaying children or having fewer than preferred. Forcing parents out of the workforce. When childcare costs equal or exceed one parent's income, families decide one parent stays home, usually the mother, contributing to gender wage gaps and career interruptions with long-term earnings impacts. Parent leaving the workforce loses income, career advancement, retirement savings, Social Security contributions, and faces challenges returning later. Exacerbating inequality. High-income families afford quality care regardless. Lower-income families struggle, relying on informal arrangements or lower-quality unlicensed care. Middle-income families face worst squeeze, earn too much for subsidies, but struggle to afford quality care. Burden highest for families earning $40,000 to $80,000. Individual strategies. Home-based providers often cheaper than centers. Family help reduces costs. Nannies or au pairs might work for multiple children. Some areas have child care cooperatives. Use dependent care flexible spending accounts for pre-tax child care payment, saving 25 to 30%. Limit is $5,000 annually. Research state and local subsidies available in your area. Policy changes needed. Universal pre-K expansion to younger ages. Substantial federal subsidies like other developed countries provide. Enhanced tax credits beyond current modest credits. Increased support for childcare workers to improve quality and supply. Childcare costs $15,000 to $20,000 nationally, more than college, and up to $30,000 in expensive cities. For 2 young children, that's $40,000 to $60,000 annually, often equaling one parent's entire take-home income.
Families need two incomes for housing, as we've documented, but childcare consumes the second income, creating impossible math. This happened because childcare is labor-intensive, can't be automated, regulations increased, facility costs rose, and the U.S. provides minimal subsidies unlike other countries. The result? Suppressed birth rates, parents forced out of the workforce, and financial strain on middle-income families. Understanding this explains why starting a family has become economically unfeasible for many who want children. Share this with someone dealing with childcare costs. Leave a comment about what you're paying. Subscribe for more videos on essential life costs. I'll see you in the next one.